The title of my topic is Flap Design, and the module will focus on the basic principles of flap designs for oral surgery in general, and specifically for surgical implant procedures. I have been a surgical instructor for many years and am now a mentor for the new implant surgeons, and I have noticed that it is difficult for the beginners to raise a proper flap. To place an implant in the right position, it is essential that there is adequate visibility and access to the surgical area. A proper raised flap will ensure this. On the other hand, if the flap is too small, there is a risk of tearing of the soft tissue and thereby scarring of the soft tissue. In addition, it may be impossible to recognize important anatomical structures, and there may be, therefore, a risk of damage to these anatomical structures during the implant osteotomy. After completing this module, the learner should be able to describe the basic principles of flap designs for oral surgery, and to describe the basic principles for flap designs for implant surgery, and lastly, to indicate specific flap designs for specific situations in implant surgery. Careful treatment planning is important to choose the right flap design for a specific implant procedure. The learner will know that a two-sided flap can be used for a straightforward implant placement with or without simultaneous bone augmentation, but the learner will also know that a three-sided flap is essential for larger bone augmentation procedures. It is important that the learner will realize that limited flap designs may preserve soft tissue and bone, but it will hamper the visibility of the surgical area. And lastly, it is important that the learner knows that flapless surgery and immediate implant placement will compromise or make the treatment complicated, and that this kind of treatment is for an experienced surgeon only.